There she is. Oh my
Hi.
gosh, it's just such a joy to have you here with us.
Lovely to be invited, Shannon. It's been a while.
It has been a lot. I've been
Yeah.
saying all week long that you were a part of this from the very beginning. That, 9 years ago today, I pretty much can know exactly where we were because we were gearing up to do the first ever show about autism that we were doing. And you were front and center and one of a core group of three BCBAs that helped to shape like our jargon of the day and all of that. I'm going to get emotional. So it's so thrilling to have you back at the scene of the crime. Did you have any idea that we would still be doing? I didn't think we'd be doing this 9 years later.
Um, no, I could not have predicted at
You
all
know,
what any of us would be doing or where we'd be now. It's crazy to me. I mean, but in a way, I'm not surprised. Like, thinking about you, Shannon, and your passion and your skills and the impact that you have through
well,
this
thank
program
you.
and in general, I'm kind of not surprised.
Well, I thank you. That's so sweet of you. But I have to say that I was so up a tree in those early days. And if it hadn't been, I mean, largely you, and there were a couple of other people who really helped me and educated me. Somebody said to me last night, how did you learn what you know? And and I learned a lot through my son having therapy. But in that first 6 months, before we went on the air, in the first 6 months that we were on the air, I learned so much from you and a couple of other people that it is. I threatened for years to write a book about what you guys gave me in that time period. So if I haven't said so before, thank you so much. And this show would not have existed without you. And your imprint is still felt on it. So thank you so very much. But you've been off and doing amazing things. And the last time that you were on the show, you were not yet Dr. Evelyn Gould, and you are Dr. Evelyn Gould now, and we couldn't be prouder of you about that. And you are a recognized expert in the field of autism, and in particular, the field of acceptance, commitment, therapy, or treatment. Which one is it? Is it therapy or treatment?
Most often you'll see acceptance and commitment therapy, but I also see people calling it acceptance and commitment training,
Okay.
acceptance and commitment coaching. So there are different ways of different people use different names for different purposes. As we know, words function in different ways in different contexts. So I think either is fine. And most often you'll hear people just say an act.
Yeah.
Mhm.
That gets a little confusing for us because, as you know, there's a charity act that's
Yes,
Autism
yeah,
Today. So
yeah.
that's the only reason why I try to specify. But talk to us a little bit about ACT, and maybe even give us a little bit of information about how you got so excited about this particular way of looking at things.
Sure. So acceptance and commitment therapy is really an approach to how to show up and do things that matter to you, even when life is really hard. So when you essentially like finding direction in adversity, that's kind of how I would think about it. It's like, how do you connect to your values and the things that are most important for your child, for you, for your family, the kind of person you want to be, the kind of parent you want to be? How do you stay on track with that um, when life is throwing all kinds of hard stuff at you? And also, even when life is not necessarily throwing hard things at you directly, we all have minds, right? We all have self-critics. We tend to be really hard on ourselves as humans. I think particularly parents, when I work with parents, they have very overactive self-critics and really a lot of difficult emotions and difficult thoughts show up in the process of doing things that matter to you, right? Because you wouldn't have hard feelings and thoughts if you didn't care, right? Because when you're indifferent, you don't, you're like whatever. But so when you're parenting a kid on the spectrum, that is like the most important thing. right? Figuring out how to care for your kid, how to get the treatment you need, how to show up for your family, how to juggle a million different roles and a million different pressures, buffer yourself against all the messages that are getting thrown at you as to how to be a good parent, how to do the right thing, like all of that stuff. A lot of hard stuff shows up. So ACT is really about how do you stay connected? Again, I'm repeating myself, but how to stay
No.
connected to what matters and find a direction, like stay going your true north, even when you're being distracted or pulled in a million different ways, and really struggling through adversity, I think. Um,
It
yeah.
makes so much sense. And I just, I mean, I was thinking about this morning and thinking about, even just last night, um, there were a bunch of different things that I needed to do. I just said, how do we set ourselves up for success? And I know
Mm,
that the best way to set myself up for success is to get a good night's sleep.
mhm,
But last night at 10:30, I had, the vet call and say that they had an opening at 10:30 at night at urgent care, that I could take the new puppy that we have inherited from, because my friend passed away. So, and I really, there's no appointments with vets. So
mm,
at 10:30 last night, we were out taking the dog to the vet. Uh, and it's like this war sometimes, that you have this
mm,
value that, I really want to take care of myself, but I want to be a good
mm,
dog owner. I want to be a good friend, and I want to be a
mm,
good parent. And all of it seems too much.
mhm,
And that it's this toss up in the moment about, like, what do you choose? How do you do? And that was like one night of my life. But I remember, and because you were around me then, that, especially when Jem was earlier and we were in the more intensive intervention and we didn't know what outcome we were going to have, that
mhm,
those kinds of decisions were so hard on a daily basis. And it ate at me. And I have come to realize that, and I was just saying this the other day, that you want your child to be independent, but you want your child to be safe. And
mhm,
those two things are almost
mhm,
always in direct opposition. And that
mhm,
alone, just those two things, for a parent
mhm.
with a kiddo on the autism spectrum, can be a daily struggle. So, how is it that ACT helps us to sort that out?
So ACT essentially teaches you some strategies that can be kind of grouped into two realms. So we have acceptance and mindfulness based strategies, and then we have commitment and behavior change strategies. And essentially, the acceptance and mindfulness piece is, I would call it the and piece, right? So rather than saying to yourself, I want to, I want my kid to be independent, but I also want them to be safe. It's like, how do I move towards, I want them to be independent and I want them to be safe. Both of those things can we make room for both of those things being present at the same time, and figure out how to choose in a direction that kind of moves us the way that we want. Um, so acceptance isn't about things being fine. It's not about liking it. It's not about saying, okay, I want this struggle. It's about making room and space, create it, giving yourself space, giving your self compassion, I think, and being willing to make room for the hard stuff in the service of what you care about. Um, and the mindfulness piece is about being present, right? Because when the hard stuff shows up, like this decision about the dog or something that you're struggling with your kid, it's not just about this moment, right? It's never just about this moment. It's about every other moment that happened before that, every other piece of your history and everything you've gone through. Everything shows up in that moment. And it can be really hard to know what you're responding to know what way to be to go, what am I being pulled by. And I think the mindfulness piece of ACT allows you to pause and breathe and get present in the current moment of what am I struggling with right now. I'm recognizing all of this other stuff is showing up. I'm recognizing that I'm having all these thoughts, I'm having a lot of feelings, I'm being pulled in different directions. How do I take a step back from that and pause, give myself the space to choose the direction I want to go in, the kind of parent I want to be in this moment, not in the future, not everything about the past, but what is the most important thing in this moment? And the next moment you get to choose too, right? So you can always, every moment is another choice of what direction you want to go in. You can always turn back in this direction, you can go that direction. So I think the acceptance and mindfulness pieces allow you to kind of pause and notice what's showing up. And then the behavior change pieces of ACT, the commitment values piece, allows you to choose. So it's kind of a process of pausing, noticing, choosing in the present moment, and then recognizing that that is an ongoing process, right? So every moment you can reorient and connect to what matters to you. And, you know, we have to do, I just, the parents that I work with, they have to do so many hard things all the time. So how, and their BCBAs ask them to do really hard things all the time. Their treatment providers ask them to do really hard things all the time. And I think it's just so important when you know you have to do hard stuff, that you know what your why is, right? It's not just, we just have to do this hard stuff for the sake of it, but that you can really connect with why you're doing this hard stuff, the longer term, bigger picture, wading through this swamp in the service of what. And I think ACT, the commitment change piece, the values piece, helps you find your why when things are really, really hard. So I think those are the key pieces. I would sum it up in that kind of pausing, noticing, and choosing process. And bring in the heart. Like, I guess you asked me earlier, and I didn't speak to this, Shannon, but why I came to ACT, but really like finding the heart and the kindness and the compassion in this struggle, because parents know so much, right? Parents, I realized very quickly as a clinician, actually, Shannon, you mentioned, you know, you learned a lot from me, but it's a two-way process. Behavioral intervention is a relational thing, right? It's about relationships. It's about relationships with kids, relationships between parents and therapists and treatment providers. It's a reciprocal relationship. And you guide us, like you guide us as practitioners. We learn so much from you. You teach us how to help you, but not if we're not listening. So ACT is so important for me as a clinician, because it helps me pause and notice what I'm responding to. When a parent is struggling, can I show up? Because it's hard to watch people be distressed. It's hard for parents to watch their kids struggle. It's hard for us to watch you struggle. So it's a reciprocal intervention too. It helps me too. And I forgot where my train of thought's going there, but I feel like that's important to say, that this is a relational process. That I noticed that we have these great tools in ABA, we have these great behavioral, we have a whole literature on behavioral parent training and how awesome it is, but that's often not what parents need, right? Actually, parents are very capable. They actually do really know how to parent their kids. They know what to do. It just sometimes is really hard when the hard stuff shows up. So it's not a lack of like, I don't know how to parent. So me coming in with my toolbox and being like, you just need to do planned ignoring or whatever, is actually not helpful. When you can step back and give parents the space and the tools they need to show up for themselves, to know how to manage difficult thoughts and emotions, to know how to navigate that with their kid and manage, you know, be able to be present when their kid's struggling, they actually know what to do a lot of the time with our support. So for me, ACT was bringing the heart and the why, like, why should this parent do this hard thing? How do I understand what they really care about and what their kid cares about and what really matters to them as a family? And everything I do should be oriented towards that, right? How do I know that? I know that through ACT. I bring compassion and self-compassion, motivation, all of that stuff, because the rest of the stuff doesn't matter if that isn't present. I think the skills training doesn't matter if the heart isn't there, the motivation isn't there. And then for me, like I said, for me to nurture that relationship and be able to learn and be present and listen really well to what parents are telling me, what they're observing, and for me to show up as a clinician with my heart and be able to keep doing that even when things are hard. So I hope that kind of gets at the gist of it.
Very inspirational. I
Mhm.
feel like I want to also say, though, that ACT wasn't specifically designed to be used with the autism community, and it isn't
True.
just with the autism
Mhm.
community. And it's really in its really infancy that in being used with the autism community. And there is a growing number of BCBAs and ABA professionals who
Mhm.
are interested in this, I think for the same
Mhm.
reasons that you have said, that, you know, if you're a well-trained BCBA, you have that set of tools and you have science and you
Mhm.
know what works behaviorally, but it isn't as easy as just, you know, programming a computer and going, okay,
Mm-mm.
that's done. You have to deal with living, breathing people who
Yeah.
are individual and have feelings about
Mhm.
what you're asking them to
Mhm.
do. And for every parent who has ever had a professional, whether it's a therapist or a BCBA, say to you, well, you just need to do this, and you're
Mhm.
like, yeah, try that
Mhm.
at 2 o'clock in
Mhm.
the morning when I haven't had sleep,
Exactly.
my other kid has diarrhea. Come
Yeah.
on, you know?
Because it's never about this moment, Shannon. So if you come in with that narrow view of like ABCs, right? It's just about the kid wants this. You said no. Now he's having a tantrum. So you just need to not, give him the thing. But that's ignoring the complexity and the depth of human experience, right? Because there is so much more history there. There is so much more going on, the richness of that. So I agree with you. I think yes, and yes, we
Yes,
have this
and
toolbox and this science, and it works. It absolutely works. I'm a full preacher about that. And we also need to appreciate, in order for this to work, we have to appreciate the realities of the parent's experience and what everyone's going through. And ACT, I think, allows us to do that a little bit more, and support parents to do really hard stuff, with all of that that's going on.
so having said all of that, you know, people are have all this love for you that they've been writing in and saying how lovely it is to see you back. But where, for the typical parent who's watching this, where would they find ACT in their community, in their,
Mhm.
where are the places that they should look to bring this more present into their lives?
Well, it depends kind of what you're looking for, but there is an organization called the Association for Contextual Behavioral Science. And
That's
that
a
is,
mouthful. You're going to have to say that
yes.
again for
So
us.
it's ACBS, Association for Contextual Behavioral Science. And they are an organization, a professional organization that supports the science and practice of ACT-based. It's ACT-based. It's not just ACT, actually. They support behavior analysis in general. There are other therapies that have grown out of this behavioral approach that they support, and they're both a scientific kind of organization and a practice organization. So if you want to get the kind of nitty gritty of it, I would go there. They do have resources for the general public on there too. Clinical resources, book recommendations, courses, things like that, and providers. So you can also find providers who are interested in ACT in their directory. Um, and I mean, also, I would suggest there are, for parents anyway, there are plenty of providers doing some trainings for parents. There is a wonderful woman in England, Gemma Gilmore, who has a blog called Parenting with Science, and she's done some nice videos on social media, ACT oriented there. Lisa Coyne and I also did a free webinar for parents on burnout, actually parental burnout, not specific to parents of kids on the spectrum, but all parents basically who maybe have kids who are struggling, and that is available through YouTube. And I can send the link to you, Shannon,
Okay.
for that. There are lovely. There's some lovely books. There is a book by Russ Harris called The Reality Slap, which is about dealing with life when it slaps you in the face. It's not specific to parents of autism, but he actually does talk about his experience of using ACT to help him when his son was diagnosed on the spectrum and what that was like for him. And I like it because it's very brief. And who has time? Nobody has time to read anything. But if you do, that's a nice book that can introduce you to ACT in a layperson way. There are some lovely blogs by Lisa Coyne, for example, for parents on an ACT approach that are easier to read than a book. Um,
And we should
so
say that
yeah,
Lisa Coyne, her name is spelled a little bit differently than what they might think.
yes, that's a good
Okay.
point. So it's Lisa and Coyne, Coyne.
Okay.
And she has actually a number of different blogs for parents out there. I would be happy to share some links with you, Shannon, as well.
Okay.
Autism-live is a good place because there's several episodes, I believe, in your archive where we talk about acceptance and commitment
There
therapy.
are.
Yeah. And
There
there are
are.
some apps now. There's some great phone apps that are based around acceptance and commitment therapy, that give you little, which are easier too than reading a book. They just are little, you can spend 1 minute learning a skill or practicing mindfulness or something.
Are there
Um,
any apps in particular you would recommend?
yes, there are. I'm just going to look at my phone. There was one that was released actually by the Veterans Association, I think, for COVID support. And I think it's called COVID Coach. And it is ACT based. Not specific for parenting, but it's a really nice, well-researched app. There is one called ACT Companion. I think that one costs money. The COVID Coach is free, I believe. ACT Companion is not free, but it was developed by Russ Harris and a few other people. It's great. It's really good.
Is
There's
there
another.
awesome autism specific stuff on that one, or
Do you know
just?
what? There isn't. So this is the piece that's missing, Shannon. So we should
Hmm.
do something about that with all the time we have. But there is
That's
not
right.
any. There's no specific books on for parents of kids on the spectrum. I really think we should do something about that sometime,
I'm
because
in complete agreement.
because the one thing I would say about ACT and why I particularly was drawn to it as well is because it's really helpful for situations that you cannot deal with via normal problem solving strategies, right? Like the chronic kind of challenges that you're being faced with when you have a kid on the spectrum. It's not, you can't problem solve everything in that situation, especially not in the short term. And
Can
ACT,
we
I
do an
think,
example so that
yeah.
people, yeah.
What do you mean an example?
So an example of
Yeah.
a type of situation that is chronic that you can't solve through other means for a parent
So,
that's on the spectrum.
well, I guess what I was actually thinking of was just that there's always another thing. Like it's that kind of situation, I think, that it's not like a quick fix here, right? Especially when your kid is diagnosed, so there are ongoing challenges, and every time you kind of get over one hurdle, there's like another hurdle. And there's another hurdle, and there's another hurdle. But some of the more chronic things that continue are like struggling with school issues, right?
Yeah.
That is just never ending usually. Finding a treatment provider that is good, provides good quality support and is right for your family, and how to fund that, and insurance and costs and financial worries, care for your kid, like that is typically an ongoing challenge for
And so
families.
doing other kinds of therapy, there's no magic wand that just
Mm-mm.
fixes all of that. You got to keep
Correct.
walking through it, is
And
what
then
you're
for
saying.
things like thoughts and feelings, Shannon, cannot be problem solved away. They come back. We can distract ourselves for a little while sometimes. We can avoid, we can do all kinds of things to not face our feelings or to avoid thoughts, to try and think positively and all of that. They're very short-term fixes. And sometimes we run into more problems more problems, because if our default is to avoid emotions and avoid thoughts and just try not to have them, they actually can come back worse, and the avoidance can lead to, it's fine to have one glass of wine at the end of the day. It's not great when you find yourself drinking bottles of wine every single day, all day. So I guess I'm also speaking to problems like, what do you do when you have difficult emotions and thoughts? Because that is something you can't just problem solve away and be like, I'm just going to not have them, right?
Right.
That's
Or
just,
the suck it
that's
up
a
theory.
dead person's goal, right?
Right,
To not have
right.
emotions is a dead person's goal, and the suck it
But
up doesn't work either.
often we're told to just suck it up. We got a child on
Yeah,
the autism spectrum, just
just
suck it up. I don't know
not
how to suck
helpful. Not
it up. I know how
not
to eat
helpful.
it up, but I don't know how to suck it up.
Right. And not helpful. And all the things you probably often people do to try and suck it up actually create more problems.
Yep.
Um,
Oh yeah.
so I think ACT creates a space where, with the acceptance piece of like, this is happening, this is what is happening, this is how I feel, this is the thought that I'm having, and I can learn how to make space for that, to be kind to myself, to treat those thoughts and emotions with gentleness and kindness. And now I'm going to spend my energy figuring out how to move forward and do the things that matter to me instead of wasting energy on struggling with trying to suck it up, because that is an energy suck that you don't have time for. It's not a good use of energy to be trying to struggle with your thoughts and emotions and make them go away and be fine. Yeah, so I don't know if is that helpful at all.
It is very helpful. We're starting to run out of time here, and I don't want to forget to put some things in here. That there is evidence to show that not only does this help a parent, but that in turn, when the parent gets that help, that there is an effect upon the child. Talk a little bit
100%.
about that. It makes great sense to me.
Yes. So, I mean, the first thought I had, well, yes, there is research to back this up, to show that when parents are supported in an act-based way, that they are able to parent in a more flexible, adaptive way for their kids. They model the skills themselves for their kids. You get so flexible parents and parents who are able to respond flexibly with respect to their emotions and thoughts instead of struggling against them. They actually parent more flexibly and they're more sensitive to the needs of the kid in the moment. We see decreases in aggressive behaviors. We see decreases in anxious behaviors. There are a lot of really good outcomes for that. And also, parents are better able to do things that matter to them in terms of self-care, for example. They're able to take action in a more productive way, in a way that supports their well-being and their family's well-being. And it is like an oxygen mask, Shannon. Like when you put your oxygen mask on first, you're way better equipped to help your child and help others in your family, for sure.
And you actually have a protocol that's how many weeks?
It's actually 6 to 8 weeks, depending on who's doing it and how you want to do it. But the one that I worked on with Lisa Coyne was actually 6 weeks.
Okay. And are you still doing the protocol, or is it just other people doing your protocol now?
I have been disseminating it to basically anyone who wants it. Actually, I've just been giving it away to many practitioners who are now using it and adapting it. I'm not doing it verbatim anymore. What I actually am doing now is running parent groups, which are actually 4 sessions. Because parents, it's hard to find the time to show up consistently to a group. And I also do act very much individually, but it's more individualized than the parent manual.
Yeah.
But many people are now using that protocol actually. And Lisa Coyne, it was adapted from one that Lisa Coyne and Phoebe Moore had created actually for parents of anxious children. And then I took it and adapted it specifically for parents who have kids with autism. So they are running that as well with anxious kids too.
So we have both providers and parents on, the different streaming services that we're on right now. And people will watch this later on, if somebody is watching and they're a provider and they're like, I want the protocol, I would like to be doing this either with individuals or with a group. And if a parent is like, I would like to have, talk to my provider about reaching out to you to do this, how would they do that? How would they reach out? How would they get the protocol?
They are very welcome to email me directly, and I can share it with their provider. I can share it with you if you're a provider. I'm fine with sharing it with parents if they want to take it to their provider. That's fine. It is a provider manual. And I think if you go, it would be unusual, and maybe this is a good test actually of providers, but it would be very unusual if you go to your provider and you say, I heard about acceptance and commitment therapy, and I really want to understand how that might be useful to me, and I'd like to integrate that in is that something you can help with, or is that something you're willing to do? I think if they react with we don't do that, that's not appropriate or whatever, that's probably not a good sign.
Right.
They may say, we don't have training and we're not sure how to do that. And then that would be a time to say, well, I heard there's this manual that you could follow, because a part of the reason for me doing that manual, Shannon, was to provide a starting point for people who are learning clinicians and practitioners who are really interested in ACT who are learning how to do it and how to do that kind of work so that anyone could use it. Like, it's written, the scripts are there, it's very step by step. It's designed for people who are new. I think obviously the more skilled you get at it, the more you can do with it. But it's specifically, there isn't an excuse really, I guess is what I'm
There we
saying.
go.
Yeah.
So where would they reach out to you at? What's your email?
You can reach out to me. I have so many emails. I'm like, which one is the best one? Probably they could reach out to my email at the eGould, the one you're using, the egould@harvard.edu. No, eGould at, let me put it in the chat, Shannon, because I'm going to mess it up.
And then I'll read it because they're not able to see the chat.
Okay.
We don't broadcast the chat.
There you go.
So eGould at McLean, so McLean, CLEAN.harvard.edu.
Yeah.
So EGOULD at MCLEAN.harvard.edu. And I'm going to say it one more time with the alphabet the way they do. E as in egg, G as in gorilla, O as in Oscar, U as in umbrella, L as in lollipop, D as in dog, at M as in Mary, C as in, I don't know what C is, C as in cat, L as in lollipop, E as in elephant, A as in apple, N as in Nancy, Harvard, HARVARD, I think everybody knows that, .edu. E as in elephant, D as in dog, U as in umbrella. And you can reach out to her there. And talk a little bit for just a minute here about what you have been doing at McLean, because anxiety is a big discussion among our parents, that we have a lot of parents and kids who experience anxiety. Can you talk for just a minute about what you do at McLean?
Sure. Well, I was working full time at the Child and Adolescent OCD Institute as a clinician there. So that's a residential and partial hospitalization program for young people, children and adolescents who have severe treatment refractory OCD and plus, I'd say OCD plus. But they have a diagnosis of OCD in order to get into that program. However, about half the kids in that program are also on the spectrum, right? Because it complicates things. So a lot of the kids there have multiple things going on. And I'm now no longer working there full time as a clinician, but I am in a consultant teaching training role there now as an associate there. And I still work privately. I work with Lisa Coyne in a private practice, treating kids with OCD, but also spectrum, bunch of all kinds of mood disorders, all kinds of anxiety disorders, and all kinds of difficulties. And we take very much a family approach. I do a lot of parent work. Sometimes I work only with the parents because the children don't want to come, right? A lot of the time the kids are afraid, kids are very stuck. They don't want to come to treatment. So maybe I just work with the parents. Sometimes I work with the kids and the parents together. Sometimes I just work with the kids. But yes, I've sort of moved to more specializing in like kids who have high anxiety, who are also on the spectrum. But of course, I treat typically developing kids and young people. I work with young adults as well. So a really nice range and very interesting. I love it. I love working with parents. I love all of what I do. I still do a lot of training and consulting and things too, and it's really fun.
Well, you are a gift to this community, and you have been a gift to me in my life. I've mentioned this before, but I had the opportunity to go through at least a version of the protocol with Dr. Gould, and it was life-changing for me. I was at a critical moment in which my child was wanting more independence, and I was stuck. I was right there in that place of, I need for him to be safe. And the world is not a safe place. And he, even though he's doing so well, this was, 7 years ago. And I needed to make the leash longer. And all I could see was that people were asking me to completely let go. And there was no way
Mhm.
that I could do that. And what Evelyn did was she gave me the roadmap. She showed me what was important to me. She helped me to uncover that so that I had a reason why I was willing to work on it. And then she gave me small, measured things that she led me to. She didn't say, oh, you must do this. She was like, what do you want to, now knowing this, what do you want to
Mhm.
do to the point where, you know, my son has a lot more freedom. I'm just going to tell you that in this, he's about to be a senior in high school now,
Mm.
and we're applying to colleges in the middle of a pandemic. Next year, when it's time for him to go to school, you're going to need to be on speed dial, because I'm going to need. I've dreamt his entire life of him being able
Mhm.
to wear the cap and gown and say, "Mom, I'm off to change the world." That was my picture in my head for all of the ABA that we did. And now suddenly that we're just, like 10 months away from that, I'm having trouble breathing, picturing him going off to college. So
Mhm.
we're going to need a brush up. I'm just going to tell you. So, because I go, I want that. I want that wholeheartedly, but it's scaring me beyond all possible belief.
Yeah.
Um,
It's hard, Shannon, because I think, something that Lisa talks a lot about too is the developmental process of parenting, right? We talk about developmental process of children and how they grow up, but we don't talk a lot about that, the developmental shifts that have to happen in parenting, and it's very hard.
Amen to that. I tell him on a daily basis, I go, listen, I've never parented a 17-year-old
Mhm.
before. Forgive me. This is my first go
Mhm.
around. All right,
Mhm.
we are totally out of time, and I know you've got another thing to go to, and so do I. We appreciate you so much for taking the time to be here with us, and we hope that people reach out to you to get the protocol. But thank you. Such a light in our community. We're deeply indebted to you. Thank you so much for being with us.
Thanks for inviting me, Shannon. Bye.
Bye-bye.
Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.